And as Mary was saying, I work at Orthopedic Rehab Specialist, and I'm an Oncology Rehab Specialist. I'm also a certified lymphedema specialist, and also treat balance disorders such as neuropathy, like chemotherapy-induced neuropathy. I also have two other colleagues I work with as well, Jenna Villafuerte and Lindsey Nauman-Kaleel. She works in Dixon. But anyway, first off, I just want to say that I'm really honored to be here tonight. And it's really great to be here amongst so many courageous and very strong people. So I'm excited to talk about oncology rehab and kind of the evolution that's really gone on in the last 10 to 15 years. Luckily, there have been some really influential people about 10 to 15 years ago that really helped to push, really including this in cancer care. So really, what is this? This is a doctor-directed physical therapy program really oriented to the cancer patient or survivor. And really what it's geared towards is really helping to combat side effects and physiological effects because of particular surgeries, various treatments that you might have had, chemotherapy, radiation, hormonal therapies, that type of thing, really based on you as an individual and what you specifically had. And really how we're different from just a general orthopedic physical therapist. We are orthopedic physical therapists, but we've had a lot more advanced training in regard to oncology in general. So we've learned a lot more about the disease process itself, the therapies that you're going to get, and what those physiological changes really, how they're really affecting you, and how we need to use evidence-based practice to help combat those. And that's really using the latest research out there that really proves what's the most effective treatment to help to combat those side effects. And so, you know, what's been really nice is to hear different patients come in, and as they're describing their history and what they've gone through, and they'll say, well, so do you know what sort of surgery that I had? I maybe had this sort of reconstruction, and I'll say, yeah, I know exactly what that is. And they'll go, oh, that's crazy. I've been to other physical therapists before, and they don't know what that surgery is. But that's what part of our training is all about. So, you know, if you've had breast cancer and you've had a tram flap, we know what that is. And we know how they do that procedure. So, you know, in the olden days, after you'd finish all your treatments, what doctors used to say is, go home, rest, slowly get back to your daily lives, and in about a year or two, you'll feel more like yourself again. And we used to say that to patients who had heart attacks too, but we don't do that anymore. Now, they go to cardiac rehab, and that's been the great change in oncology care, is that we're headed that same way. That, because now we have a lot more aggressive treatments, and a lot more people are surviving, and in fact 12 million people in the United States are currently survivors, that now there's more people potentially with some side effects, and so there's a greater need for physical therapy. So there's lots of research out there that really supports that virtually all cancer patients, no matter what stage they're in, would benefit from physical therapy if they are facing side effects such as cancer-related fatigue. They'll receive increase in strength, increase in endurance, and increase in quality of life. So, we really have a wide variety of patients that are referred to us. It's really, there is no end to the spectrum, but our most frequently referred patients are breast cancer patients or survivors, prostate cancer, lung cancer, liver cancer, ovarian cancer, patients with brain tumors. They're really, that's not all inclusive, but really the side effects that we're really trying to help out with could be cancer-related fatigue, because 70 to 100% of the people are affected with that, and that can last for months to years. And sometimes, you know, other people around you just may not understand that. And so, could be lymphedema, could be muscle mass loss, it could be increase in weight gain, it could be osteoporosis, or neuropathy, numbness and tingling in your hands and feet. So, typically, I just want to tell you just a little bit, you know, if you were referred prior to finishing all your treatments, we see people along various stages to while they're still a patient into survivorship. So sometimes people are referred maybe before a surgery, and really why that even is the case is because we want to empower people and make sure you know when to, maybe if you had breast cancer and you had a mastectomy or a reconstruction, you know when to move your arm, you know how much to move your arm, and you're not afraid that you're going to disrupt any sort of surgery or ruin anything. But the biggest, most important thing is that we're not going to have long-term problems with your shoulder in the meantime. Or, if you're following up with radiation after your surgery, that you make sure that you have enough range of motion in your shoulder so you're not delaying radiation treatments. Because as we all know, if you're delaying treatments, then it's not quite as effective. But we might see people too during transition points, like maybe we're setting up people on more of a home program. Maybe we touch base with somebody before radiation and we teach them just a few things. We know your schedule is very busy. Maybe it's more appropriate for you to do things at home. You have a lot of fatigue. But it's really important to try to do some aerobic exercise, which doesn't mean I'm going to have you run around or anything, but maybe it's walking and trying to progressively walk up to 6 minutes a day, because research shows if you do that, you increase your red blood cell levels and you help to maintain them, which helps to decrease that fatigue overall. So anyway, we really try to encourage people to start doing that. Another time we might see them too is maybe right before chemotherapy, and the whole idea would be maybe just tweaking their home program if that's more appropriate for that person, and really based on what kind of drugs that they're receiving. And again, that's part of our training. So I want to know, are you receiving a taxane drug or maybe a platinum drug? Then you might be more susceptible to having neuropathy. So I want to make sure, okay, well, what's your house like? Let's decrease your risk for falls. Let's teach you a few exercises so you maintain your strength as best as possible during that time. Try to teach you maybe a few balance exercises, fairly easy and not something that's going to be so overwhelming, so that you're maintaining your strength. So if you are having a little bit of a loss of balance, those muscles are strong enough to keep you more upright, so you're not risking an injury. But helping to maintain your balance as well. Sometimes people have more long-term nerve pain with their neuropathy, because that can last for a few months, but it can last for years or even a lifetime. So sometimes people are referred even into survivorship because they still have problems with this. So we teach them maybe how to modify things, how to work on strengthening, maybe how to change an activity a little bit so you can still do it, so you're not eliminating all sorts of things out of your lifestyle. I have patients, maybe they were a dental hygienist, well, they don't want to give up their job, so we want to teach them how to compensate for different things. But again, being aware of the kind of treatments that they're getting and really what those side effects really mean. What we really tell our patients too is that we're really kind of lifelong consultants. So if you ever have a problem that comes up in the future, give us a call, because we would be glad to help brainstorm and figure out maybe a new problem that you might have or something else that's going on, and if you need to come in or if you need to seek out some help from your doctor, that type of thing. I just wanted to give you a couple other examples of some other problems that we might see. A lot of times people might have more problems with like tissue restrictions. Like, for example, we have head and neck cancer survivors that maybe their radiated field was from their shoulders up to the top of their, pretty much up to the top of their face. And so over a 1.5 year period, you can have more scar tissue that's kind of laid down in that area, more fibrotic tissue, and it's not quite as stretchable as our normal skin and our muscles. So we want to teach them how can we kind of massage appropriately across that skin to help get that mobility back. And a lot of times they're first in pain, and so maybe they start having more of a stooped posture like this. So we want to teach them proper stretches, again, how to massage that skin to make that much more flexible, how to strengthen the upper back and work on those joint mobility to help get their posture a little bit better. But help to address some of those problems, but also maybe with those particular patients as well, they have a lot of nutritional problems, so we really have to watch how hard we really work them and what sort of exercise we give them, because they've already probably lost a lot of weight. So we've taken a lot of those factors, but again, it's because of kind of our background and really trying to take into account of that particular individual, what they've gone through. I gave a couple examples for why maybe a breast cancer patient or survivor might come in. Other things too might be lymphedema. Potentially if I saw you right after surgery, we would try to get some of that swelling under control. That's normal. But if that lasted even after your treatments and it becomes more chronic, then we try to work on that. And whether that's trying to work on massage to try to get rid of that, teach you that same thing, doing some bandaging or a garment. But again, other people are susceptible to that as well, possibly patients who had prostate cancer or ovarian cancer, people that probably had lymph nodes removed or radiation to those lymph nodes. So we really, as best as we can, try to encourage, trying to have people come in as soon as possible, so we're trying to prevent a lot of those problems. Just an example, I had a patient that came in and he had stage 4 prostate cancer, had androgen deprivation therapy, so he had increased body weight, had increased cholesterol and glucose levels. So we really worked on trying to get, and he had a very busy schedule too and had a lot of fatigue. So we really got it down to maybe he did 5 exercises, worked on walking, and he had neuropathy. But his big goals were, I want to get out to see my buddies once a week to have coffee. And I still need to go to my family barbecues at summertime. So we'd go outside and we'd work on balance and maybe just get, a few exercises that he could really handle that targeted large muscle groups, because that could decrease your body fat much faster. And it was something nice and easy that he could control and work with. And so, but a lot of times he said, this really made my day. Everybody was really concerned about how I did, and people encouraged me to go outside and work on those things so I could still stay in touch with all my friends. And that's the biggest thing, is that we just want to really help improve your overall quality of life and get back to things that you normally did. So those are my main examples. Thank you so much for having me come talk. I was really anxious to tell you some updated things about what's going on. I also wanted to just say too that we taped this talk tonight, so that information will be on our website. We did include some magnets too with our website. We have more information regarding different side effects that you might have experienced or might experience in the future because of your treatments. Or what I also wanted to say is that, again, we would love to be a consultant for you. If you call in and you have a question, we would be glad to help brainstorm as far as maybe, if you need to be able to be seeking help for that, or which direction you really need to go. But thanks again for